Today, we're diving into a topic that can be pretty scary and confusing: blood clots. There are major new medical guidelines out for 2024, and our job is to translate all that complex medical speak into something you can actually use. So let's get right into it.
Picture this. You get a sudden, sharp pain in your leg. It feels like a cramp, but it just won't quit. Or maybe even scarier, you're just going about your day, and suddenly, you can't catch your breath. These aren't just little aches and pains, you know? These are alarm bells, potential signs of a blood clot, and it's something we absolutely have to pay attention to.
So, what are we actually dealing with here? To really get a handle on the problem, we need to speak the language. The medical world has a very specific name for this, so let's break down what it really means.
Okay, the big term you need to know is venous thromboembolism, or VTE for short. Think of it as the big umbrella name for this whole condition. And under that umbrella, there are two main players, and telling them apart is absolutely critical.
So on one side, you have deep vein thrombosis, or DVT. This is usually where it starts. A clot forms in a big vein deep inside your leg. Then you have the other side, the one that's way more dangerous, a pulmonary embolism, or PE. A PE is what happens when a piece of that DVT breaks loose, takes a trip through your bloodstream, and gets lodged in your lungs. So a DVT can lead to a PE, and a PE is a flat-out medical emergency.
So you're probably wondering, how common is this really? Well, take a look at these numbers. This isn't some rare, 1 in a million disease. Every single year, for every 1,000 people out there, almost 3 will get a DVT, and about 1.5 will have a PE. It's way more common than most of us think.
But, and this is a huge but, just because a doctor suspects a clot doesn't mean you have one. Look at this. For every 10 people who get checked for a DVT, only 2 actually have it. And for a PE, it's even lower. Only about 1 person out of 8 who gets checked is confirmed. This is exactly why we need a smart diagnostic process to quickly figure out who's really in trouble and who can breathe a sigh of relief.
So how do doctors sort all this out? Well, the new 2024 guidelines are all about working smarter, not just harder. Honestly, you can think of your doctor as a kind of detective, following a trail of clues to get to the right answer as quickly and safely as possible.
And it's a really logical, step-by-step process. See, it always starts with you, your symptoms, your personal history. Then, the doctor uses a checklist to kind of score your risk. If the risk looks low, they'll do a simple blood test called a D-dimer. It's only if those first steps point to a real possibility of a clot that they bring out the big guns, like an ultrasound or a CT scan. And that brings us to one of the biggest, most important updates in the new guidelines. For anyone with a suspected pulmonary embolism, doctors now have this much sharper, more intelligent tool in their toolkit. It's called the years algorithm, and it's a real game changer.
And you might think it's some crazy complex thing, but look how simple it is. The whole thing boils down to just 3 questions. Are there signs of a DVT in the leg? Is the person coughing up blood? And, just based on everything, is a PE the most likely explanation? The answers to these questions guide the whole rest of the process.
And let's be really clear, this isn't about cutting corners. It's about being smart. The whole goal of the years algorithm is to safely rule out a PE without having to do a CT scan, with all its radiation and contrast eye, unless it's absolutely necessary. This new approach helps doctors avoid scans for about half of all the patients they check. That's huge.
Okay, so let's say a clot is confirmed. What happens now? What's the plan? Well, the new guidelines have made treatment a lot better too. For most people, it's now significantly safer and a whole lot simpler. The big news here is a major shift to a newer class of drugs called DOACs, and you can see why right here. Compared to the older drugs, the VKAs, they have a much lower risk of causing serious bleeding. Plus, it's a fixed daily dose. And this right here is a massive quality of life win. No more constant blood tests to make sure you're on the right dose.
But that doesn't mean the old meds are gone for good. Not at all. They are still the absolute right choice in some very specific cases, like for people with certain kinds of artificial heart valves or a rare condition that makes your blood extra sticky. It's all about using the right tool for the right person. All right, let's tackle a question pretty much every single person with a DVT asks. What is the deal with those super tight compression stockings? For years, they were basically mandatory.
Well, here's another huge change for 2024. The new guidelines are clear. Stockings are no longer the standard recommendation to prevent long-term problems. The evidence just isn't there. But, and this is important, they can still be used for what they're good at, which is making you more comfortable and helping with that painful swelling right after you're diagnosed.
So, you're through the initial treatment, you're feeling better, but the journey's not quite over. So what happens now? Let's talk about the big decisions that really shape your health in the long run.
How long you need to stay on blood thinners really comes down to one question. Why did the clot happen in the first place? If it was provoked, caused by something temporary, like a big surgery or a long-haul flight, then treatment is usually just 3 months. But if it was unprovoked, meaning it just came out of the blue, then the plan is 3 months of treatment, followed by a really serious conversation with your doctor about whether to stay on them for the long haul.
And why is that conversation so incredibly important? Well, here's why. For people who have an unprovoked clot and then stop their medication, the risk of having another one within 5 years is about 30%. That's a huge risk, and it's why continuing treatment is so often the right call.
And even after the clot itself is long gone, it can sometimes leave a ghost behind. The most common long-term problem is something called post-thrombotic syndrome, or PTS. It can affect a big chunk of DVT patients, causing chronic, life-changing problems like pain, swelling, and just a constant heavy feeling in that leg.
Okay, we have covered a ton of ground here, from the first signs to how doctors figure it out to the very latest treatment plans. So let's pull it all together, because the whole point of knowing this stuff is to help you become a more confident, more empowered patient.
So, if you only remember a few things, make it these. First, know the symptoms. Trust your gut. Second, know that diagnosis is a smart step-by-step process. Third, those newer drugs, the DOACs, are the new standard for a reason. They're safer and easier. Fourth, compression stockings, they're for comfort, not required prevention. Fifth, that talk with your doctor about how long to stay on treatment is non-negotiable, especially if your clot was unprovoked. And finally, get up and walk. Bed rest is officially a thing of the past.
So we'll leave you with this final thought. Now that you're armed with all this new info, what's the #1 most important question you would ask your doctor? Because being prepared, asking those smart questions, well, that's the first step to really taking control of your own health. Thanks for joining us.